Hyperbaric medicine, relatively new in the country, but it's been here almost around 10 years. What we have here is what we call a soft chamber for hyperbaric medicine, which gives a lot of oxygen. For this soft chamber, it's noted to be very good based on some studies with regards to performance of athletes. Most of the clients here are mostly athletes recovering from injuries. If you go down to the cellular level or the biochemical level of recovery from injuries or even due to wear and tear of vigorous exercises, we know if an athlete would have exercise throughout the week, normally what will happen in his body, it will be built up of what they call lactic acidosis or ammonia, where increase of oxygen would be able to release these toxins out of the body. So recovery for these patients would be faster, or for these athletes. For recovery for regarding sports injuries, we normally look at three phases for recovery. One is the inflammatory phase, proliferative and remodeling. In all these phases, again, if you go to the biochemical or cellular level, oxygen will play a vital role with regards to recovery. For each of these phases, which would normally last for a couple of days to even months, depending on the severity of the injury, oxygen normally at high levels would decrease these phases. So athletes would be able to return back to their normal activities or even to playing in a sooner period of time. With regards to recovery, again depending on the severity of the injury, hyperbaric oxygen therapy, aside from it increases the oxygen levels on the tissues, it also builds up new blood vessels. So with regards to what we call angiogenesis, in some injuries, sometimes the blood vessels are already injured, or even in older patients. So with regards to hyperbaric oxygen therapy, it builds up new vessels. So in effect, it creates more oxygen to that area which is affected. For older patients, most of the patients who come to me for hyperbaric oxygen complain of insomnia, they have difficulty in sleeping, and most of them also have joint pains due to their age, arthritis, which is normally an inflammatory process. So hyperbaric oxygen therapy would be able to benefit them in this with regards to anti-inflammatory process or effect of hyper oxygenation. So normally patients who undergo hyperbaric oxygen therapy for arthritis, normally after probably 5 or 6 sessions, they normally see a relief with regards to their pains. They sometimes decrease the amount of pain relievers they have to take. So they see the big effect of HBOT with regards to these illnesses. And patients who had difficulty in sleeping due to the sleep pattern, after 2 or 3 sessions of hyperbaric oxygen, they tend to have better sleep. They don't have cut sleep, or their sleep pattern is almost 8 hours as they had when they were still younger. Hyperbaric oxygen therapy has also been accepted by most of the community because of its natural remedies. I mean, meaning we don't have to take any medicines, or this doesn't need to be given through intravenous route, or no injections, no pain. The patient just normally enters the chamber and breathes naturally the oxygen up to a certain level of pressure. So this is normally the toxic effects of these are not as bad as taking medicines or any other method. I have also some patients who have come to me with regards to hangovers, or patients who have drunk the whole life, lack of sleep. Yes, there is a scientific basis actually how hyperbaric oxygen could help them. This is also similar to patients who have jet lag or who have had long travels, lack of sleep. Hyperoxygen normally relieves them of these symptoms. Their fatigue, with regards to also hangover. Alcohol normally creates a reaction in the body where you have to really urinate a lot or you void a lot. So you lose a lot of water in the body. And as we know, that oxygen is part of combination of H2O or water, hydrogen and oxygen. Increasing the oxygen level in the body would normally um, relieve the patient of his symptoms of fatigue and normally they have heavy head or headaches. Also, patients who have migraines have also benefited from this therapy. Or maybe chronic migraine patients tend to take a lot of medicines, pain relievers, and most of my patients who have tried hyperbaric medicine have decreased their intake of medicines with regards to severe migraines. And for you athletes who have sports injuries, normally the most common will be ACL tears, MCL tears, sprains and strains, ankles, shoulder injuries. Definitely, we could say that we want to invite you to try out hyperbaric oxygen therapy, and you will see the difference with regards to how fast your recovery will be. In combination, of course, with the proper physical therapists who would guide you through your recovery here in Focus Genetics.